breast cancer. She resides in Shropshire, England, and most of her care throughout her life has been with the British healthcare system. Her son, my husband Richard, developed the same colon cancer as his mother at a relatively similar age. He was here in California under Sigma's healthcare plan, and with that care, he lived to be 58. And when he died, we had a mortgage of thousands of dollars for the prescription drugs and the co-payments that our insurance did not cover. My question to you, sir, is do you have, and you referred to this earlier, do you have any statistics or figures regarding life expectancy of American citizens compared to their peers in other industrialized countries who have single-payer or public health care programs? And if you do, could you please state your source?
First of all, we're all sorry for your husband, husband that passed away so young. But statistics I do have for cancer. Statistics compared to, on cancer, you live anywhere compared to Canada and the UK, depending on the type cancer you get, from 2 to 7 years longer if you're in the United States. That's stat I have. Over here.
Hi. I'm Paul O'Rourke Babb, and for 32 years I have been a primary care clinician. And I also, several years ago, was diagnosed with a progressive chronic disease, which required me to be on disability for slightly more than a year. And I really strongly believe, had I not been a relatively well-paid healthcare clinician, I would have had to declare bankruptcy behind the disorder. My private insurance company tried to kick me off at every turn of the way once I was diagnosed. And I have a little bit of a preface here, and I want to make people aware that one of the things that we can't do with this issue is base our decisions on anecdote. If we want a system to work, we have to apply the scientific process to that, and that's what's made medicine everywhere great. And I want to throw out one of the issues as part of that scientific process for everybody to understand about the cost, and that is risk pooling. It costs each one of us as individuals far less money for our healthcare system to support it the larger the group is that's in a single system. Having said that, I also want to preface my question for you by pointing out that in 2008, 21,000 people in the United States died as a result of lack of access to health care for financial reasons. In 2007, the number was 19,000. These are very sobering numbers. In the meantime, what Congress had done, and I will take you and other members of the Congress to task over this kind of a thing, but also over the history, and that is, several years ago, the Congress voted to let private insurance companies administer Medicare, and since then, Medicare's costs have gone up 11% due to overcharges from these private insurers. That's not a problem with Medicare. So I would like to know, number one, how you voted on that, and having pointed out that drug costs go from 5,000 to 60,000% rate increase from manufacturer to retail, 5,000 to 60,000% cost. I think we have plenty of places in the private sector that we could deal with cost overrun. So I would like to know how you intend to deal with that, and I also would like to know if you're planning on joining the 122 representatives from all over the country in Congress right now that are not only supporters but sponsors of H.R. 676, health insurance for all of us.
I don't know, there's a lot going on there, but we're going to try to get around to as many people asking questions as we can. I've answered it already.
Good afternoon, Congressman Herger. Thank you for the time. As you and the fine people in your office already know, and I commend the people in your office, both in Chico and in Washington, D.C., very fine individuals. I am a constitutional conservative, and I do not read in the Constitution separation of church and state, welfare, education support, nor national health. My question, a quick two-part question. Why is Congress and the United States not following their job description, the U.S. Constitution? Second, and perhaps more importantly, why is Congress even entertaining this ignoble premise, historically proven to be a failure and a non-existent responsibility of the Constitution? And are you, sir, if it's passed, going to join it? In conclusion, I would like to request that you give us our money back. God only asks 10%, and he runs a much larger and more efficient operation.
We're coming to the end of the time. It'd be nice to get as many comments in as we can. I think the comment had to do with the Constitution. We know how the division of powers between the administrative and the legislative. It ultimately boils down to you on whether you feel the Constitution being interpreted correctly and vote against people. Now we have a health care. Some would question, where does it say in the Constitution that we should have a health care system at all, a national health care system? The fact is we have one. It's there now. I think it behooves us to make it run as efficiently as we can, and we need to bring these costs down. That would be the best answer I could give you. And then follow us at every election, which I'm sure you're doing.
Hello, Mr. Herger. I met you before. President Obama has been in office 8 months, and I was wondering what you or your party have given suggestions for what we can do about this. I haven't heard anything. And today I came and I was handed HR 676 Weiner. I'm wondering why this hasn't been put out for us to look at before.
Well, what have we suggested? I'll tell you, just when this bill came up with only a few hours to look at it before our committee, we had 38 amendments that we thought would improve it. As I mentioned earlier, one of those 38 amendments was tort reform, so that our physician wouldn't have to continue running every test that they did. This would be a savings, pull dollars that we could put to the doctors and others where we needed 120 to $200 billion. That was one of a number of different things that we have. We've mentioned a few. We do have several alternative pieces of legislation that are out there. But we're not in control. Our bills aren't being heard.